Thank you so much for joining us today. Good morning. I'm Jim Skogsberg, President and CEO of Advocate Aurora Health, and I'm happy to be with you this morning. We're pleased to have community members joining us from across Wisconsin and Illinois and all the communities we're so proud to serve. We can see people logging in from Green Bay, Oshkosh, Milwaukee, Racine, Libertyville, Park Ridge, Chicago, Hazel Crest, Bloomington, and other cities and towns in between. Welcome. We're glad you've joined us and grateful for the trust and confidence you have in Advocate Aurora Health. I know there are a lot of folks out there who are anxious about and interested in how our health system is responding to this pandemic. And many of you have questions about how and when to access care and what to expect when you do access that care. We're here to answer those questions and to address your concerns. We have assembled a great team here today who will help field questions in their areas of expertise, and let me introduce them to you this morning. To my right is Mary Beth Kingston, our Chief Nursing Officer. Dr. Rob Sitrenberg, Director of Infectious Diseases, to my left. To his left is Terica Richardson, President of Advocate Lutheran General Hospital. And then on my far right, Al Mancham, Senior Vice President of Support Services. All of these individuals have been personally involved in our pandemic response and have been providing great leadership throughout our health system. So there'll be great resources for you here today. Now, a few housekeeping notes for you. First, please submit your questions and comments in the field below, and we'll try to answer as many of them as we can in the time that we have available. Next, if we do run into technical difficulties, we hope we don't, we'll make this video available on our Advocate Aurora Health Facebook page for later viewing. We'll also have closed caption available when we push this out. And then finally, please take the survey after the town hall to give us your feedback. It's important to us, and we expect to have other town halls in the future, so your feedback will be valuable. Before we get started, I want to comment on something that you've probably seen in the news, as doctors across the country have been raising this concern. A lot of people have been foregoing the care, their own care, over the last few months. Some appropriately, and some probably not. And we certainly understand why, as the fears around COVID are very real. We are concerned that many of you are not seeking the care that you need, whether that's chronic issues management like diabetes or hypertension, whether it's skipping necessary screenings like mammograms, whether it's missing vaccinations or immunizations for yourself or your children, putting off procedures that can have a significant impact on your wellness. All of those are concerns to us, so please hear our message. Providing the safest, highest quality health care to the communities we serve is and will always be Advocate Aurora Health's top priority. As we resume operations, we are committed to doing just that in a safe and thoughtful way through a phased approach, allowing us to carefully turn the dial and reactivate areas that were put on hold during the pandemic. That includes continuing care delivery through our virtual platforms, our LiveWell app, and the My Advocate Aurora website, but also taking steps at our sites of care to provide reassurance and a safe environment for patients and team members. We're calling this our Safe Care Promise, and here's what that entails. Masking, ensuring anyone who enters our locations is wearing a mask, and if you don't have one, we will provide one. Screening, taking the temperature and asking questions about symptoms and exposure to everyone who enters our locations. Social distancing, rearranging our waiting areas and staggering appointment times to reduce traffic and create safe spaces. And by the way, you can see if there's a wide shot that we are doing social distancing right here, right now for this program. Another one, virtual check-in, facilitating check-ins with digital devices for seamless, low-contact arrivals, and enhanced cleaning, adding additional cleaning precautions in all areas and added hand washing and sanitizer stations. Those are very, very important to us as we make our safe care promise to you and to the communities that we're so privileged to serve. So let me turn to my right. Mary Beth Kingston, our Chief Nursing Officer, has played a huge role in our safe care promise and ensuring our patients have this experience every single time. Mary Beth, anything to add to what I've already said?
Yeah, thanks, Jim. Safety has always been a top priority at Advocate Aurora, and particularly now, of course. So that commitment really has not changed. However, we have added, as Jim noted, some additional precautions, and I think that these are very important to note. It's our promise to you. But we're just not talking about it. all of our team members, our physicians, our nurses, environmental services, all of our team, they are working every day to deliver on that promise and to keep that commitment to you. I am so proud of the way our organization has responded to this, and I'm so proud of the commitment of all of our team members. They are absolutely committed to keeping your safety at the forefront with every visit, every single time.
Thanks, Mary Beth, and stay tuned. We might have some follow-up questions on that, but well said. So proud of the way our team has responded and that focus on safety. First and foremost, a safe clinical enterprise. Okay, so let's get into some of these questions. Here's the first one that came to us. We have, I think, 4 or 5 that came in advance. So the first question is, what are we doing to expand testing? Great question about expansion of testing, but Dr. Citrenberg, I'd like to start with you. Let's just talk about testing for a moment and kind of level set, because boy, the language that's being used out there, it can be confusing. You know, microbiology tests and serology tests and antibiotic tests and so on. Do you mind just kind of level setting for the audience today?
Sure, Jim, I'd be happy to. There really are 2 kinds of tests. There's one test that tells you if you have the disease now, and there's another test that tells you if you've had it in the past. Most of the testing we're doing now is the testing to determine if you have the disease now. That's that nasopharyngeal swab you've heard about, where they stick the swab deep into your nose to get a specimen. And that's a really good, very accurate test to determine whether or not you have COVID-19 now. There's several different types of those tests, but they all fall into the same category of testing for active disease. The other test that you've probably heard about lately is the antibody test. When you are exposed to a virus, your body makes antibodies. And there's a blood test now that can detect the presence of those antibodies. What that does tell us is that you've been exposed to the disease or had the disease. What it doesn't tell us is if you are immune to it, meaning you can't get it again. And that's going to require further study. Once we have information about that, that may actually be very helpful to get people back into society.
And Rob, let me just stay with that for a minute, because we've all had conversations with family members, friends, colleagues, and people in the community who don't fully understand this. And so part of the value of this education program is to make sure you do understand. And so your notion of getting tested, I could test, tell me if this is true, I could test negative today and get exposed to the virus tomorrow or the next day. So we don't want folks to have a false sense of security, because, as you've always said, you need to social distance. You need to sort of follow the rules, whether you test positive or negative. Agree with that? Additional comments?
I completely agree. That's exactly the point. Regardless of what your antibody test tells you, you still need to practice all of our safe practices, social distancing, sheltering in place as an order, and keeping away from other people who are sick. Eventually, that test result may be useful in knowing that you can't get the disease again, but right now we don't have that information, and we don't want people to change their safe practices at all, no matter what the result of their test is.
And then, Dr. Citrenberg, you made another comment earlier that bears repeating, and that is the antibody test that is all over the media today. And it's a valuable test. It's important to know if an individual has a presence of antibodies. But I think, as you've said, you got to trust the science. And right now, the science doesn't tell us exactly what the presence of antibody means. So there are folks out there that think I've got antibody, so I'm bulletproof, or I'm COVID-free, or I can't get it again, or I'm immune. And we just don't know that to be true. So there are some limitations to the testing that we want everybody to understand. Having said that, the question put to us originally was, what are we doing to expand testing? And so, Al, why don't I kind of kick it to you, and you can talk about what we're doing throughout Advocate Aurora Health to expand testing.
Sure, great. Thank you, Jim. As many of you have heard, there has been a national shortage of testing all across the country. At the beginning of the pandemic, really it was only the sickest patients who entered our hospitals who were able to be tested. And those tests were sent to state labs. And we'd often, our patients and their families would often have to wait for more than a week to get those results. That was unacceptable. So the scientists here at Advocate Aurora started to develop our own test. And that test has been approved by the FDA. And it actually meets the standards for the highest level of accuracy and reliability per the Centers for Disease Control. Now, our patients get their test results in about 24 hours, so a big improvement there. We've also been able to expand our testing as a result of that. But before I get into that, I do want to clear up one more thing on the testing, and that is screening versus testing. And Jim, you touched on this just a little bit
No,
because
thank you. That's
some people
appropriate.
confuse those two, I find. So screening, as Jim mentioned, is when you come into one of our hospitals or clinics and we take your temperature and ask you a few questions about your exposure, your symptoms. But the test, as Dr. Citrenberg said, is really getting the nasal swab and sending it off to the lab, finding out whether you're COVID positive or not, so we can set the treatment. But to answer the question about expansion, so we're really focused in 3 areas there. The first of those is inside our hospitals. We need to expand our testing inside the hospitals. We're also looking at the communities. We have a responsibility to get out into the community and do some testing as well, so we're expanding there. And then the third is in our local businesses. They have a desire to get back to work and get their people back to work, and we want to support that effort. So those are the 3 areas we're focused on. I'll touch on each one individually. The first of those is inside our hospitals. At this point, we're now testing all of our patients, not just those that come in sick with symptoms. We're starting to test all of our patients. And that is really in keeping with our safe care promise that we put out there and to reduce the spread of COVID. We're also testing now patients who come in about 48 to 72 hours in advance of having surgical procedures or certain other procedures. Starting to do that. Those tests will happen at our hospitals through drive-thrus in most locations. Some of them have a few other locations, but largely through our drive-thrus. I'm also happy to report in our hospitals that we're now one of the first hospitals or health systems in Illinois or Wisconsin to begin testing our own team members at select sites. So we're pretty proud of that. We're going to be moving forward with that as well to help stem the tide here a little bit. When it comes to communities, as the largest healthcare system in both Illinois and Wisconsin, we have a responsibility to get out and test our community members. And we know that each community is a little bit unique, whether it be an urban location, a suburban location, or a rural location. So we're looking at various ways to deliver that community testing. It could be through large-scale or small-scale drive-thrus, or even micro-mobile solutions. So those are on their way. Pay attention to social media. It'll be coming soon to the hardest hit areas first, and then we'll be expanding from there. Pay attention to social media. You'll see when they're coming to a community near you. So those are our community expansion. Looking at the businesses, local businesses, we're now assisting them with their efforts to do this. And we're setting up a program that includes dedicated hotlines for those people to call into. It includes virtual health visits, and it includes testing. So we're helping them get back to work, and we're pretty proud of those efforts and just getting into that now. With that said, there is something, that's the 3 things we're doing. I'm going to mention something that you can do as well for us and to help with our efforts here. And that is, if you have had COVID-19, it was mentioned earlier with the antibody, if you've had COVID-19 and you want to help those that are suffering in the community, go ahead and reach out to your Advocate Aurora physician and request an antibody test. That test will determine if you're eligible for blood plasma donation, and that plasma will be used to help and assist with those that are really sick out there and trying to beat this disease. So please do that. The last thing I'll mention is that testing really is critical to our safe care promise. It's critical to expanding testing to our community and stopping the spread within the community. It's also important to get businesses get everybody back to work and get our businesses going again, and really important for the fight in this disease. So that's the expansion.
Yeah, Al, thank you. Great response to the question, and you mentioned so many important things. I want to go back to what you said at the very beginning. To really answer the question, what are we doing to expand testing? It's all about getting the materials to us so that we can do the testing. Our labs have the capability of performing up to 10 or 12,000 tests per day, but we don't have material. I think we have material for literally less than half that currently. So what we're doing is we're talking to all the manufacturers, all the vendors, we're talking to the White House, we're doing everything we can to get more testing materials so that we can then take this testing to the community. You'll hear more about that in the days and weeks to come, but you mentioned it early that there's a national shortage. We are experiencing it as well, so we can expand testing only so much as we have the material to perform the tests. Okay, that's a question. Additional comment?
I was going to say, the good news is that we now have the quantities to start to test in the community. We did not have that just a few days ago. So we're getting there, and we're ready to go and kick this off in the near future. But we did not have that just a few days ago.
Exactly, and we got to see that keep coming.
It'll be a slow uptake, but we will see rapidly more testing.
All right, next question. It says, I'm worried about going into a hospital. Are they really safe? Nobody better to answer that question than the president of one of our hospitals. And Terica, you are here today representing all the hospitals of Advocate Aurora Health. So respond to that question, because it's a natural and genuine and a real concern people have.
Absolutely. And, over the past few weeks, it's been really interesting as we hear these questions and concerns. Absolutely, it is safe to come into the hospital, and we encourage people, if they're experiencing concerns with their health, whether it be a chronic disease or something that is even greater in terms of impact to their health, that they seek the necessary care, whether it's emergency care, elective procedures, an imaging procedure. Our facilities are ready and prepared to take care of you in a safe manner. Jim, you mentioned it earlier about our safe care practice, this notion of social distancing, masking, enhanced cleaning, all of these steps we've taken to ensure your safety. And it's important that it's the safety of our patients, it's the safety of our team members, our community, our physicians, for everybody. So our priority, number one, is to make sure that you're safe and ultimately that you receive the care that you need.
Terica, respond to this. I'm in conversations with colleagues across the country because this is obviously a worldwide pandemic. So all my colleagues are wrestling with the same things. We have sort of talked among ourselves that, in fact, this may be the safest time to go to the hospital because we are on a super heightened awareness, right? PPE, masking, gowning, testing, screening. And so we want to respond to that question. Hey, is it really safe to go? It is safe. We're going to do everything we can to make it safe for you. No one would ever say that we are completely COVID-free. And Dr. Sittenberg, I've heard you say on more than one occasion, we can't say that until we have herd immunity or we have a vaccine, both of which are probably, 12 to 18 months away? So we'll be living with this COVID for quite some time, and making our environment as safe as we possibly can is really what we're all about. So Terica, thank you for that. All right, so let's go to the next question. There may be another surge that's even maybe worse than this. What can we expect in the coming months? Dr. Sittenberg, I know you're tracking all this data, all this information, all these models. I hope that's wrong. We hope we don't see another surge, but what's the latest from the research you're looking at?
Thanks, Jim. I'll start with the good news. We have seen a significant decline in the rate of growth of COVID-19 in our community, the so-called flattening of the curve. It didn't happen by itself. That happened as a result of social distancing and sheltering in place. That's really worked, and it's actually worked very well. So we have flattened the curve. What we're trying so hard to do is to prevent that curve from bending back up, and the so-called second wave that you've probably heard a lot about. We know from experience with other pandemics in the past that a second and sometimes even a third wave of infection can occur after the first one has subsided. We think there will be a second wave of COVID-19, but how bad that is yet to be determined, and probably is very heavily influenced by how well we do, how well we continue to shelter in place, and how well we continue to social distance until we reemerge into society. And when we do reemerge into society, which we're going to start to do very soon, it's not going to be business as usual. There's going to be a new normal that's going to include ongoing social distancing and measures. If you go to a restaurant and restaurants open, they won't be open to full capacity. People will still have to wear masks, and we'll have to take those same precautions. So we want to make sure that when we go back into society, we're smarter now with all the knowledge that we've learned, and that will help to prevent the height of the second wave. I'm sure there will be some, but we can make it manageable ourselves by what we do. So we have the power, the ability to control how high that second wave goes.
So Rob, if I can ask, there are so many models out there, and many of our listening audience are probably tracking Johns Hopkins or Mayo Clinic or CDC and so on. Are there certain models that you rely on more than others for those that are kind of interested in that?
That's a really good question, because there's so much information. We're overloaded in the media and on social media with all kinds of opinions. And I tell people, please trust reputable sources. You mentioned the Johns Hopkins model, which I think is the best one. They track the daily cases in every state, in every country throughout the world every single day. I look at it every day to get a sense of what's going on. And that's an example of a very reputable site. I would recommend avoiding sites that don't seem reputable, that are just individuals' opinions rather than based on science. We really do have to trust the science here. The science will get us through this.
Great response, thank you, and a good question. So the next one, what services, we've talked about turning a dial, not flipping a switch.
Right.
And this question is a great one. So what services are available, and should I call to reschedule? Mary Beth, do you want to just kind of we've turned the dial,
Yep.
What have we turned back on, and let's talk about rescheduling.
Sure. So first of all, what services are available? Basically, all services are available. We've gradually and very slowly turning that dial. We're starting first with the emergent and urgent and anything that would cause any long-term impact to someone's health. So there is a prioritization that we are doing. But we encourage you, please reach out and call your physician, your nurse practitioner, your provider. I think that one thing that everyone needs to keep in mind is that during this time, it may take a little bit longer to get an appointment. We are very carefully and mindfully examining the spread of COVID or the prevalence and incidence of COVID in our communities, and that does factor into our scheduling routine. So yes, call. We will also try to call you, but I encourage you, my advice is to reach out. Again, this may take a little bit of time, but I want to reassure folks that we have our team working around the clock as we begin to turn the dial on what we call reactivation. Another thing that I would like to mention is one of the components of that Safe Care Promise is virtual check-in. Please check your LiveWell app. And if you don't have a LiveWell app, please download your LiveWell app, because we'll be pushing out information that helps you to schedule and register online so that you don't have to have as much contact during that process as well, which is really wonderful. And most of all, if I just one quick message is that above all else, your safety and well-being is our top priority, and we are here to provide the care that you need.
Thanks, Mary Beth. So the answer to that question is yes, go ahead and reschedule. Make that phone call, and our staff are standing by to get you in and meet your health care needs. I'm going to go to the tablet now, because there are other questions that have been coming in during the course of this commentary we've been having. Let me take the first one, which I just learned about this morning, and it says, with the lift of the stay-at-home order in Wisconsin, there were reports of a nurse out at a bar last night without a mask on. How do you respond to that? And truthfully, I only just heard of it this morning, so I don't have many facts. But Mary Beth, do you have anything additional?
Again, just heard of it this morning. I'm disappointed in that. We work very hard with all of our team members to ensure that folks are following the appropriate safety measures, particularly in the hospital. And we screen all of our employees every day before they come to work. We've also been working with doing a lot of education, actually, with our team members for what they can do to be safe once they leave our hospital walls. And certainly we'll be following up with individual nurses as needed.
Yeah, so I'm going to put you on the spot a minute, and also Dr. Sitrenberg. So last night, out, no mask, possibly exposed. Number one, will we test that nurse, for the audience that's kind of curious about that? And then number two, will that, within that 24-hour time period, is that the right time to test? Either one of you.
I'll let Rob take the test first.
It's probably too early to test. And the question of when to test is a very tricky one. We know that the average incubation period, which is the time from exposure to the time the disease presents, is about 5 days. But the test probably won't become positive immediately. It may not become positive till the second, third, fourth, or fifth day. So there's really no reason to test a person in that situation. It is extremely important to monitor for any signs or symptoms of infection. Obviously, should that person develop a fever or any other signs of infection, they absolutely should be tested.
Yeah. And we have a very robust employee health service. We'll be following up with that individual person and saying, where were your contacts? Do you have any symptoms? So really, we look at this individually on a case-by-case basis in terms of immediate testing.
Yeah, thank you both for that. Next question, and a good one. This pandemic has created high anxiety and depression. And the question is, what are we doing in our health centers using Zoom or other platforms to help people with mental illness? Commentary?
I'd be happy to speak to that. So we're doing a number of things with our team members as well. So team members and our patients. Team members, we've got support groups and mission and spiritual care, following up with them routinely. For our patients in our communities, we know that this has created tremendous anxiety. And as we're expanding our virtual platform, we are also expanding our virtual behavioral health platforms as well. So again, we're here to serve all of your needs. And particularly, I think this type of situation accentuates any anxiety that might be there and also produces additional. So it's a part of our care.
And you have said this so many times, Mary Beth, during this pandemic, that I mean, it stuck with me, and that is, you know what? Call.
Yeah.
Reach out and call. We are prepared to assist you and help you, but the first thing you got to do is identify, self-identify. So
Yes.
if you're feeling stressed, if you're feeling depressed, let us know so that we can help.
I think the phrase we use is, it's okay to not be okay. That stigma, we're all feeling it. So if it's really creating any distress at all, reach out.
And speaking of creating distress, this next question, we're aware of the distress this creates. It has to do with our visitor policy. During this pandemic, we have reduced dramatically and significantly and appropriately the number of visitors that we've allowed into our institution. So this specific question is, can you address visitor restrictions and pregnancy appointments not being allowed to have a companion there? I know we've talked about turning the dials. We're starting to turn this one back a little bit, aren't we?
Yeah, we're evaluating that. You know, in the beginning, it was extremely important to limit visitors. And, you know, I'm a nurse. Patient-family-centered care is the core of what I do, so very difficult. And it's caused a lot of distress for our team members and certainly for our families. But the goal was to reduce the number of individuals who could potentially spread this or transmit disease. As we're beginning reactivation, we're working with our infectious disease professionals and others to determine where and how we begin to lift some of these restrictions. We want to, again, do it cautiously, thoughtfully, and appropriately.
Yeah, thank you. Next question, we'll keep moving through these as they come up. Maybe, Dr. Sitrenberg, to you, what science are you using that requires every person to wear a mask when I have studies that state otherwise? So this caller, this writer, is saying that he's reading studies that suggest we don't need to mask everyone, but yet we are. So your response to that?
Sure. Masking is probably one of the most controversial aspects of this entire disease. It's important to know that masks protect others from us rather than us from others. If I were to have the disease and not have any symptoms or even have some symptoms and I wore a mask, that mask would help to prevent me from spreading that to other people. So in order for masking to be successful, everybody has to participate. The way I like to think of it is that masks don't protect each of us, they protect all of us. When we all wear masks, that way if there's anybody who has symptoms or has the disease without any symptoms, then we can help to prevent the spread to others with masking. So the universal masking policy, both inside the hospital and actually outside, is a very effective one in reducing the transmission of the disease. I should just say one of the things that's so unusual about this virus compared to others is that it can be spread very easily by people without symptoms. Our initial efforts focused on identifying people with symptoms, fever, cough, etc. We learned very quickly that wasn't going to be enough. And probably the single best intervention we can do to prevent the spread of this disease from people who don't have symptoms is for everyone to wear a mask.
Thank you for that. Good question about the masking. And, you know, I guess what I'm thinking is, boy, if we're going to err, let's err on the side of safety and protection, right? So I absolutely appreciate your response, Rob. Next question. Al, I'm going to put you on the spot here because it's kind of a specific question, and it may be unfair, but I'll ask it anyway because it's a great question. It's, how are you sanitizing exam rooms between visits? So what are the steps that we're taking to make sure that that next person in comes into a clean environment?
Sure, thanks, Jim. There is a number of things we're putting into place in order to make sure that you're safe when you come into one of our exam rooms or any one of our buildings for that matter. So we've increased the frequency of cleaning, and we've looked at all of the cleaning supplies that we use to make sure that they're capable of actually killing this virus. So we're confident that what we're using kills the virus, and now we're increasing the frequency with which we clean, and we believe that that's going to help us deliver on that safe care promise.
Every surface, every floor, Any places that get touched?
The high touch areas especially are getting hit hard because those are the places where people tend to touch. So those areas like door handles, horizontal surfaces, all of those types, exam tables, anything where you might touch are really getting a lot of attention.
And again, the important part of this is after every single exam. So the room's being cleaned dozens of times a day.
Exactly.
Yeah, thanks very much. Okay, next question. And Dr. Sitrenberg, back to you because it's sort of a science question. If a person is asymptomatic, are they always carrying the disease or only for a 14-day period?
It's a good question, and it's a hard question. So, as I mentioned, this disease is unusual in that it can be carried, it can be transmitted by people who don't have any symptoms. Now, as it turns out, the vast majority of patients who have this disease ultimately do develop symptoms. They don't really stay asymptomatic for their entire course. A few do, but most develop at least some symptoms. So we don't know exactly how long people are contagious for. That's been one of the very difficult parts of this to figure that out. But we have some criteria, and generally if someone is without symptoms, without fever, if they had symptoms, the symptoms have resolved, and there's a period that has elapsed of 10 to 14 days, we consider them to be not contagious anymore. Now, there are some exceptions to that, but for the most part, that applies. So if somebody does happen to go through their entire course without any symptoms at all, and on day 14, they have no fever, they have no cough, we would presume that they are no longer contagious.
Thank you. Thank you. Thank you. Next question. This has, Al, again, a question of you, and I'm reading these, and these are very thoughtful questions. How is the air conditioning thought to work? Are offices recirculating used air? Will there be more windows open? Are we having incoming fresh air somewhere? Talk about air circulation, because that's really the heart of the question.
So inside our hospitals, it's a good question, and fortunately inside our hospitals, we have systems that prevent the transmission of this. So when the air is recirculated, it is filtered before it's put back in. We do not exit. We exit a certain amount of air to the outside as well. So it'll come in, some will go out, some will be recirculated. But the primary thing to pay attention to there is that it's all filtered so that we do not have any risk there. There are situations where we put patients in negative pressure rooms as well, and I'll explain that because I think that's an important thing. When you have an infection, if you're in a negative pressure room, it actually pulls air from outside the room that you're in and exhausts it directly to the outside so that you're no longer contaminating the rest of the hospital. So we have those rooms in place as well. In fact, in some of our hospitals, the one we're sitting in right now has an entire unit that exits the air outside. So.
Yeah, thanks. Thanks very much. Okay, next question. If one does not feel comfortable at this time going to a facility for blood work and then a routine checkup a week later, are there options like a virtual visit with your doctor to go over how you're doing without getting the blood test? I'll take that and then turn it to the rest of you. The answer is absolutely. Virtual visits are a wonderful way of staying connected with your caregiver absent the face-to-face interaction. Now, at some point in time, if a blood draw is required, that's going to have to take place. But virtual visit is a great place to start. We literally went from essentially 0 virtual visits. I think we just did our 300,000th virtual visit. So we are embracing that technology. It works great for you. Our patients that don't necessarily want to come in but want to stay connected. So please call and schedule that virtual visit. It's easily done, and we're happy to do it. Now, additional comments about that? Anything else you guys would add?
Yeah, I would just say that it's very variable. It's very individual as to whether or not you need a blood test. So the first step would be, if you're very nervous about coming into a site, the first step would be to have a virtual visit. But then you need to talk with your care provider about your own healthcare needs. If you need a blood test, if you need an imaging study, again, we have set up very safe policies and procedures to allow that to happen. So it would be individual based on your clinical presentation and history.
Thank you. Thank you. Next question. I think we've answered it, but I'm going to raise it up again just to make sure for the individual that wrote it in that we address it clearly for her. What's involved in the virus screening process when you check in? Is it just getting your temperature taken, or is there more involved? Al, you were talking earlier, Mary Beth as well, about this notion of we are definitely taking temperatures. Okay, so temperature, absolutely, and then a series of questions asking about signs and symptoms. Dr. Sittenberg mentioned cough, those kinds of things. Is there anything else you would add to this screening process?
I think
Does that cover it?
Yeah.
Yeah, so I hope we've answered that question. Temperature, and then a series of questions.
We'll add one thing there.
Yeah,
The other
please.
question is about exposures. If you've been around anybody, so not just your own symptoms, but have you been exposed to anybody who may have this? So that's the other big question.
Okay.
We had been asking about travel, but that's kind of
Yep.
in the past now, and just assuming it's
Yeah.
in the community.
Right, because who in the world is traveling?
Traveling.
now? Yeah, exactly. So here's a question. I'm 87 years old. I have not had any human contact for 2 months. In order to get a refill for potassium, I need a blood test. I don't want to go anywhere. What do I do? How would you, Dr. Sittenberg, how would you advise this individual, or Mary Beth? I'm immediately thinking about our home care nurses,
Yeah.
our home care folks that go to the home. That's one option, but is there anything that comes immediately to mind?
Home care is certainly an option, but again, we're doing everything possible to create a safe environment for people, and we have to be very mindful, especially someone who's 87 years old is vulnerable. But it's still, if there's essential travel that's required, it can still be done safely. And the most important thing is you mentioned, Jim, not to forego other health issues just out of fear of getting this disease. That there has to be a balance. And we've created safe environments for people to come get tested when they need to, but of course only for essential visits.
Thank you. Thank you. And please, I know the writer apparently does need that test. So as Dr. Sittenberg said, please get that test. We'll make it safe for you. I know it's anxiety producing, but we're going to take good care of you. So come on in and get that blood test. Next question, is there a way to boost your immunity to help fight the virus if you are exposed? Again, lots of information out there, and I'm sure some credible and some not, but Dr. Sittenberg, any response to what can I do to boost my immunity if I've had COVID?
There's really nothing specifically you can do. And if you read on social media, there's all kinds of suggestions. You can buy things that claim to boost your immunity. The fact is, there is nothing that you can take to boost your immunity to protect you against COVID. And that's really important because some of these products give people a false sense of security. They feel like they're boosting their immunity, therefore they don't need to take the same precautions. And we really discourage people from doing that. The most important thing is to do whatever you can to maintain a healthy lifestyle, good nutrition, activity, because the healthier lifestyle you have, the less likely you are to get sick from the virus. But unfortunately, there are no over-the-counter medications or supplements that have been proved in any way scientifically to help.
Thank you. A few more questions, and this is a good one. Jean is writing this, and Jean is saying, why isn't the panel wearing masks? So, Jean, I want you to know that we all came in with our masks, and we had them on as we were interacting with one another. But, Dr. Sittenberg, again, we've mapped this out. We're 6 feet apart. That's appropriate social distancing. Do you have a comment about the need to wear masks when you are social distancing?
So if let's say you're outside in an outdoor environment, you really don't need to wear a mask in that outdoor environment, but you do need to wear a mask in any situation where you're going to be in an indoor space where you're going to be less than 6 feet apart from someone. So in general, if you maintain your distance, while certainly even in our hospital, for people who work in the hospital, we do wear masks all the time. When you are especially outdoors and farther apart, then you don't need to wear a mask in that situation. But I always tell people carry a mask with you, because if you're outdoors walking and then you go into a store, you go into the grocery store, you do need to wear your mask in there.
And Rob, your question just answered one further down about, do we have to wear a mask when we're outside doing outdoor activities? Obviously, you just said no, but have one with you in case you come into contact with people, et cetera. So we've addressed that question. Now, I'm going to skip around a little bit because we've been talking about masks, but here's a question about gloves. And of late, there's been a fair amount of conversation out there about gloves and transfers and so on. Do you care to comment about the use of gloves?
Gloves are a little bit trickier than masks. The problem with gloves is that, first, people often don't change them. They wear the same dirty gloves around, which really accomplishes nothing. The second thing is you can't clean gloves. You can clean your hands, you can disinfect your hands with alcohol, hand sanitizer. You can't clean your gloves. So I wouldn't say that gloves are required or mandatory. And in fact, in many cases, it's preferable not to wear gloves as long as you carry some hand sanitizer with you and can disinfect your hands frequently.
Yeah, so maybe even better to take the sanitizer with you. Yeah, thank you for that. Next question, it's a good one because I think all of our team members wonder about this one. We were just chatting about it recently, and Al, I'll look to you for additional comment, but it says, what about using elevators at our facilities? And I know of other institutions, and we're about to embark upon this course of action where we're going to put our elevators in such a position that they stop routinely and regularly on every floor, so you don't have to push floor 5, you don't have to push floor 7, you don't have to push anything at all. They will simply stop. Now, it's going to take you longer to get your destination, without a doubt, but it avoids having to do the pushing of the buttons once you're inside the elevator. Comments about that, Al?
Yeah, I'll make a couple of comments on that. Actually, we are limiting the number of people on the elevators, even on the patient transport elevators. Only those that are necessary to move that patient or to get on that elevator. And then for those passenger elevators, largely it's our own team that are on those elevators, but we're limiting the number of people on those as well so that we can, or making those recommendations. I mean, people do what they want if they overcrowd it, but we're making those recommendations. Please do not overuse the elevators because we want to keep that social distancing. On top of that, we're all masked as well in our hospital, so that's how we're handling elevators.
And Al, I'll add to that too, we're also very focused on the cleaning of those elevators. So every day, multiple times throughout the day, that's a part of our routine to ensure that the environment's safe.
Yeah, those buttons are cleaned frequently, all the time.
Yeah, thank you, Tarek, for that good comment. We're down to just a couple more questions. I know we have a couple more minutes too, so bear with us. And this is a bit of a conundrum for me personally anyway. It says, with the lift of the stay-at-home order in Wisconsin, and we all know about the Supreme Court, et cetera, but with the lift of the stay-at-home order in Wisconsin, do you still prefer people to stay home instead of going out to restaurants and social gatherings? The reason I say it's a bit of a challenge is that we got to get our economy back rolling again. We all need our economy to get back rolling again. So I'm of the mind, and our infectious disease doctor may be wanting to kick me under the table here, but I'm of the mind that if we protect ourselves appropriately, social distancing, that notion of going out carefully, thoughtfully, doesn't seem to be the wrong thing to do. Now, there was a social gathering question in there, and I probably am one of those saying avoid the social gathering because there's no way a social gathering allows you to do social distancing properly. But I'm going to turn to the expert and have you comment on that. And you can tell me if you think I'm wrong.
No, I don't think you're wrong. There has to be a balance. We can't go on like this forever, there's no doubt. So what we have to do is to figure out how to safely re-enter society. And that includes continuing to social distance and wear masks when we need to in indoor spaces. We have to figure out a way to do it safely. I think that we're at an advantage now compared to 2 months ago because we understand the disease so much better and we have a good understanding of how to prevent it. So, as I said earlier, it's not going to be business as usual. There's going to be a new normal that looks very different from what we were used to in the past, but we should be able to continue to re-enter society safely.
Thank you. And then one more question, and we're going to wrap because I know we're out of time. What are you doing about crowding in clinic waiting rooms? Again, our Safe Care promise, you go into our clinic waiting rooms that are going to look entirely different tomorrow than they did before the last time you were in because we are enforcing the social distancing. So the rooms are all redesigned to provide you with the appropriate spacing necessary. So you can be safe about our waiting rooms. Okay, unfortunately, we are out of time, folks. But we're going to continue this conversation in the days and weeks ahead. So we want you to check out our website and our social channels for the latest news and information, and we hope to see you again on another program like this. Your feedback is really important to us, and we want to hear from you. So as a reminder, please take just 2 minutes to fill out the survey at the end. And again, thank you for tuning in, and we thank you for the trust and confidence you have in Advocate Aurora Health. Until next time, stay safe.